Hi everyone, my name is Ivy Gowans, and today I will be seeing if strength training will make my bones any stronger. Let's start with the basics. Bone density is a measurement of the amount of calcium and other minerals in a segment of bone. A higher mineral content indicates a higher bone density and strength score. A bone density test is used to detect osteoporosis and monitor its treatment. They are also known as a bone mineral density analysis, or BMD. Bone mineral density, or BMD, estimates the true mass of bone. A BMD analysis is recommended for women between ages 50 and 65 with risk factors for osteoporosis. In addition, men and women taking certain medications, such as steroids, or have certain diseases should discuss testing with their doctor. Exercise is known to increase bone density and improve bone health. However, not all exercise is equal when it comes to building strong, healthy bones or preventing osteoporosis. Some forms of exercise may decrease bone density, even in elite athletes. Researchers from the Bone and Joint Injury Prevention and Rehabilitation Center at the University of Michigan reviewed research as far back as 1961 to determine what impact exercise has on bone density and bone health. They found 3 characteristics of exercise that have the largest impact on increased bone density, which are: Number 1. The magnitude of strain the exercise imparts. Exercises that fit into this category include weightlifting and gymnastics because of the amount of force or impact exerted on the muscles is significant. Number 2. The rate of muscle strain the exercise does. Consider this high-impact, weight-bearing exercises that are done in repetition, such as jumping or plyometrics. And number 3, the frequency that exercise strains the muscle. Here's where running and jump roping come into play, because of the repetitious impact to the bones that occurs frequently during an exercise session. The magnitude, rate, and frequency of strain during exercise all play a role in developing greater bone density, but the researchers didn't determine which is the most important of the 3. They did say, though, that bone density can be increased by as little as 12 to 20 minutes of weight-bearing exercises 3 days a week. A recent study done by Brigham Young University in Utah found that jumping 10 to 20 times a day with 30 seconds rest in between each jump provides a greater bone-building benefit than running or jogging. Researchers found that running can have less impact on bone density because of the repetitive bone stress. Evidence also shows that exercise may help build and maintain bone density at any age. Studies have shown bone density increased by doing regular resistance exercises such as weightlifting 2 to 3 times a week. This type of weight-bearing exercise appears to stimulate bone formation and retain calcium in the bones. The force of muscles pulling against bones stimulates this bone-building process, so any exercise that places force on a bone will strengthen that specific bone. Experts recommend the following forms of exercise in order to increase bone density and prevent bone loss. They include weight training, especially squat exercises, plyometrics or jumping, stair running, body weight exercises such as calisthenics, jumping rope, running, hiking, or backpacking. There are exercises that can decrease bone strength. Swimming and bicycling are not considered weight-bearing exercises and aren't usually listed as one of the exercises that increase bone density. In fact, there is evidence that elite cyclists actually lose bone density during high-intensity training and racing. Researchers are not entirely sure the cause of bone loss in cyclists, but the current theories include the non-weight-bearing nature of cycling, minerals including calcium are lost at an enormous rate during hours of sweating, and the impossible energy imbalance, more calories are used than consumed, during hours of intense exercise. Building and maintaining bone mass requires more than weight-bearing exercises alone. A combination of good nutrition and weight-bearing exercise is the ideal way to build bone mass. Once we reach about age 30, we don't build bone as readily, so building adequate bone density early in life is the best way to prevent osteoporosis later.